Okay, dear students, today we're going to learn about the 7th video for the MCQs of the P2 class. Let's see here. We go to first MCQs. Which of the following group articulates with the transfer process of the thoracic vertebra? When we talk about the articulation with the transfer process, then we are having the first group here. Which one is articulating with the also transfer processes? 11th and 12th, they only articulate with the body. Number 2 question, the most important characteristic feature of the thoracic vertebra is the body has the costal facets is one of the very important characteristic that we can differentiate it. So let's have a look here that on the body we are having here the costal facets. Number 3, the lower larger facet on the head of a typical rib articulate with the demifacet on which part? So let's see that when we talk about the head, lower demifacet is articulating with the superior part of the cross-bending vertebra. So here we got here superior part of the, so that is the B is the correct answer here. Next we got here question number 4. Then in the question number 4 that we are having here the order of structures in the upper part of the intercostal space from above to the downward, intercostal space above to downward. So see here that abovely that we got here the vein, artery and the nerve. So that A is the best answer here, vein, artery and the nerve. I always remember as the vein, V-A-N, vein. Okay. Next question number 5 that we got here, parts of the transfer thoracic are all except. So transfer thoracic here are the muscles. Okay, so these 3 A, B, C, they are all belong to, but we know that serratus posterior superior is not the part of that. So the D is the best answer. Let's have a look here that we got the serratus posterior superior muscles here, those they are not the part of the thoracic, transfer thoracic. Next question we are going to talk about, that is the question number 6. Which of the following arteries are enlarged in correction of the aorta? So in this condition the internal memory, subclavian is the main artery, which one is giving the branch as internal memory, and then interior intercostal are coming from there. So the best answer should be the C, the posterior intercostals. Okay, so posterior intercostal are having enlargement or swelling due to this portion. Which posterior intercostal veins of left side drains into accessory hemizygous veins? So we got here accessory hemizygous vein and the left side. So the best answer is the 5th to the 8th intercostal vein on the left side draining. Here we go to the accessory hemizygous and 5th to the 8th are draining into it. Next we got here the question number 8. Which one is not a branch of the internal thoracic artery? See that the internal thoracic artery is giving the 2 terminal branches, what we give them the name as the superior epigastric and the musculophrenic artery. Anteriorly it is also giving the branches as the anterior intercostal, but posteriorly it is not giving, so that is the best answer, posterior intercostal, because they are coming from the aorta. So here we go to the answer. Next we got here question number 9. Thoracolumbar outflow start from lateral horn of which segment of the spinal cord? So if you remember, sympathetic and the parasympathetic outflow is talking about the same thing here. So thoracolumbar is actually the sympathetic outflow, so it is from the T1 to the L2 segment. Okay, here we got the thoracolumbar outflow. Next question is the question number 10. Following are the effects of the sympathetic on the skin except. sympathetic effect are working as here, but this is not the effect of the sympathetic on the skin, decreases the pigmentation. So here we are having comparison, sympathetic, parasympathetic. Okay, so thank you very much. See you in the next video.